5 to 7% of all pregnant women are suffering with diabetes. And this diabetes in pregnancy is what is called as gestational diabetes mellitus. It is 11-fold increase in Asian population, which means we are more prone to develop diabetes in pregnancy, and this in turn in future can become a diabetic patient for life. So what is GDM or gestational diabetes mellitus? Gestational diabetes mellitus is hyperglycemia of variable severity with its first onset during pregnancy is called as gestational diabetes mellitus. Also, a pre-existing type 2 diabetes mellitus first recognized during pregnancy also is termed as gestational diabetes. So normally pregnancy is a diabetogenic state, means due to the change in the pattern of insulin secretion and sensitivity, the blood glucose levels vary. During the first trimester of pregnancy, the fasting glucose and insulin is unchanged. But in the second and third trimester of pregnancy, there is decrease in the fasting glucose and increase in the insulin secretion. So this will in turn alter the blood glucose levels in the body, and you are more prone to develop diabetes. So like hypertension, screening of diabetes is also very important, and treatment of GDM results in better outcome of both mother and the fetus. So how do we diagnose diabetes in pregnancy? Diagnosis of GDM is by screening methods like risk factor assessments and also by laboratory tests. The high risk factors are when the mother is a member of an ethnic group, when she has a previous history of diabetes, a family history of diabetes mellitus, then glycosuria at the first prenatal visit, PCOS patients, then pre-pregnancy obesity, age more than 25 years, previous history of big babies, previous history of GDM, then they have unexplained stillbirths, history of repeated abortions, use of corticosteroids, polyhydramnias. So all these are high risk factors which we have to keep in mind when we are assessing the patient for diabetes mellitus. Lab tests include the glucose control test, which is the best, and the diagnosis can be confirmed by OGTT, that is the oral glucose tolerance test. We also have fasting blood sugar, random blood sugar, glycosylated hemoglobin, and serum fructosamine levels. Both screening and the lab tests have sensitivity of 50 to 60%. The diagnosis of gestational diabetes mellitus is mainly by the OGTT, which is 2-hour 75 gram glucose test or 3-hour 100 grams glucose test. And this is very important to be done between 18 to 20 weeks. It is this time when there is a change in the plasma glucose levels and can be diagnosed and treated early so as to prevent the both mother and the fetal outcome. So when we have diagnosed them as GDM, the important points you should remember is blood glucose monitoring all throughout pregnancy and post-delivery at regular intervals, glycosylated hemoglobin once in each trimester, renal function test depending on the degree of glycemic control, endoscopy, that is examination of the eye, 24-hour urinary albumin and creatinine levels, urinary ketones, the blood pressure monitoring, then urine input-output chart, ultrasound on a regular basis, and also NST and other routine investigations which we usually follow during antenatal period. The management of GDM is a multidisciplinary approach wherein an endocrinologist, dietitian, neonatologist, anesthesiologist, and of course obstetrician all are involved in the treatment of this GDM patient. The primary goal is to obtain a near normal glucose level, and of course in order to reduce the morbidity and mortality of both the mother and the fetus. So regular monitoring is very important. Keep watching my channel so that you can be more updated with the recent treatments and management of complications during pregnancy.